I want to welcome those who are on screen or who will be on screen as we begin this conversation. Professor Timothy Caulfield is the Research Director of the Health Law Institute and Professor in the Faculty of Law in the School of Public Health at the University of Alberta. Thank you, Tim, for joining us. Also joined by Moira Donegan, who is an opinion columnist at The Guardian US. She is a writer in residence at the Clayman Institute for Gender Research at Stanford University. We're also joined by my colleague, Professor Larry Gostin, who's the founding O'Neill Chair in Global Health Law and also co-faculty director of the O'Neill Institute. We're also joined by Regina Mahone, who is the senior editor at The Nation, Skye Perryman, who is the president and CEO of Democracy Forward. Thank you, Skye, for being with us. And Mark Joseph Stern, who's senior writer at Slate Magazine. And I am Michelle Goodwin, and I am co-faculty director of the O'Neill Institute for National and Global Health Policy, and also the O'Neill Professor for Global Health and Constitutional Law. Now, as I frame this conversation that we're going to have today, if we look back at just even the earliest weeks of this administration, of the second Trump term, it tested the rule of law in the United States, one could say, like never before. Some have even called it a constitutional crisis. Some have said that not since Watergate has there been such glaring challenges to the rule of law and questions with regard to presidential power, and even the potential of having seized power, flouting checks and balances, and instilling a sense of trepidation and fear amongst government employees and even really all Americans. And there have been a number of threats that have already taken place and actions already in progress towards civil servants related to their employment. There have been challenges and attacks on journalists for reporting on unlawful executive orders. There have been the vows to investigate critics of the administration, and some have said that this is an atmosphere of hostility towards civil servants and prosecutions of critics and of people who have served in previous administrations, which has heightened alarm domestically and also abroad. There are important checks on presidential authority that can be used by Congress, the courts, governors, states' legislatures. States' attorney generals can push back against executive orders, and we've seen that in policies implemented by this administration. And of course, Congress possesses the authority under Article 1, Section 8 to control the federal purse. That's not something that the president has authority for. But there are questions about whether these checks and balances are actually in place or being respected by the administration. And there are serious concerns about what all of these issues mean globally. And so turning to then this session on 100 days of the Trump administration, I want to begin by asking, what have we seen in this first 100 days in terms of executive actions impacting health policy? What are the implications for the administrative state and the rule of law? And first, what I'd like to do is turn to Larry Gostin and ask you, Larry, what have we seen in this first 100 days in terms of health policy and executive actions?
Thank you, dear Michelle. It's great to be here. I'm going to cover global health and international relations, and I know we have to be quite speedy. So I'm just going to list 4 executive actions that the president took on his very first day in office that have caused cascading crises at home and abroad. These 4, some are well known, some are not. One, of course, was a letter sent to UN Secretary General announcing the intent of the United States to withdraw from the World Health Organization. At the same time, President Trump immediately withdrew all funding from WHO and withdrew all CDC and other staff, seconded and instructed HHS officials not to communicate with WHO. The second thing is a freeze on foreign aid. particularly, as we all know, the subsequent dismantling of USAID, which has had enormous rippling effects around the world in terms of humanitarian crises, food security, global health security, and many, many other areas that United States has led on. And then two that we probably don't realize, or at least most of the public. One was that the president on day one immediately disavowed the 2024 historic amendments to the international health regulations. This is particularly sad since the United States, through the Biden administration, was a leader in really pushing that through. I can give you some really interesting stories about how that took place with Secretary Becerra in Geneva. And then finally, he withdrew from negotiations on the pandemic agreement, a pandemic treaty in light of COVID that's actually this week going to be its final negotiating session in Geneva. I will only say this. I can't think of one way that this advances American national interests or American national security, and I can explain that as this seminar goes on. And the second thing is that it has been so destructive to the international community, to American standing and leadership in that international community, and that many more problems are going to ensue, particularly the reauthorization of PEPFAR, our work in global health, AIDS, TB, malaria, measles elimination, and so many more things. We're in real trouble in global health, but it's been a deep wound to the global health community, but I think even a deeper wound to American national interests.
Thank you so much for that, Larry. And I will circle back in terms of what those impacts look like, both globally and also at home, especially as there have been Americans affected by what was perceived as global cutbacks in terms of financial support, which have serious implications at home. But of course, we know that we live in a global community, not one where, disease does not understand borders. Skye, I would like to turn to you and think about, well, what has this meant in terms of legal advocacy in the wake of these health-related cutbacks?
Thank you so much for having me. We've seen you were approaching the first 100 days, that the courts really are serving as a real front line in the pushback against this administration's attack on evidence, on science, on healthcare, and on access and equity. And so we have seen over 140 cases brought against this administration. By the time we get to the first 100 days, I know it'll be over 150 cases. And what's important to note about that is that we're seeing judges across the board, whether they were appointed by Democratic presidents or Republican presidents, or even President Trump himself in his last term, stop, slow down, or otherwise, impose some scrutiny on this administration's actions. And that includes actions that will affect and do affect the healthcare community. So one takeaway is that the courts are going to continue to be a real front line with respect to seeking to protect healthcare access in this country, seeking to protect evidence and science. We're seeing, we've seen nationwide injunctions issued to prevent the defunding and the unlawful funding terminations at NIH. We got a good nationwide court order blocking the two anti-diversity, equity, inclusion, and accessibility executive orders. That is now on pause pending some appeals, but you're going to continue to see, I think, these broad orders. What that has engendered, of course, from the administration is a very politically motivated attack on the courts. We've seen the administration attack lawyers and attack judges. And so we're really going to be calling on all communities, including the healthcare access and equity community, to continue to support and understand the rule of law. So that's one trend. The other thing that I wanted to emphasize, in addition to the policies that have already been mentioned, are we've also seen the administration retreat from really important protections that were the subject of litigation in the prior administration. So we've seen, for instance, the administration back out of efforts to ensure that federal law that protects all people and enables all people, including if you are pregnant, to get emergency care under the Emergency Medical Treatment and Labor Act, EMTALA. We've seen them back out of legal challenges that the previous administration instituted against states that had been banning reproductive health care and abortion, of course, in the instance of these emergent situations.
Skye,
So
if I could just pause you
yes,
there, which is
absolutely.
basically what you're saying is that a federal law, the Emergency Medical Treatment and Labor Act, which is meant to protect any and all Americans in
Yes.
times of health crisis, that this administration has decided that that's not something worth fighting for, at least
that is correct. And so these are efforts that the administration is taking that are not as bold as the signing of an executive order on national television, but are things that are happening. In some instances, they're trying to do it a bit more quiet, but they're happening and they affect millions of people across the country. At Democracy Forward, we have intervened in cases to protect HIPAA privacy and privacy regulations where we're, concerned that the administration will undermine some of those protections. And so what I would encourage the viewers today to do is to know that we've just seen the beginning, that there are a range of things that are floating somewhat under the radar that are going to be very important to address. Our team at Democracy Forward, along with so many others, is committed to doing that the courts are going to remain a core piece of this pushback. And the other thing to emphasize is that many of the attacks that we're seeing have come out of the White House and executive orders, but we anticipate that we will begin seeing really concerning actions out of the agencies themselves. So what will happen as RFK Jr., continues to take the helm at HHS, what happens with the agencies under new leadership, and that will be a place to really look and focus as we're moving forward out of the 100 days.
Thank you so much for that, Skye. Skye and Larry, I'm going to come back to you with just a follow-up, but I want to turn to Mark because Mark, you've just done such incredible, impactful work in following the courts and reporting about trends taking place, constitutional trends taking place amongst our courts. We've been on the stage together as major rulings are coming down from the Supreme Court. We were together just last year as the court was issuing its opinion in the immunity case involving Donald Trump. What's been your sense in terms of the judiciary dynamics that are shaping or blocking what the administration has done in its actions?
Yeah, I think it's a very odd situation we're in right now, where I think all panelists would agree the courts cannot save us, right? And the Supreme Court itself is as much an author of this current moment as any other institution, especially with its immunity decision, shielding Trump from criminal prosecution during the election, ensuring he could remain on the ballot. And yet now in this moment with Trump in the Oval Office, with Republicans in control of Congress, the courts are the only defense against some of the administration's most egregious actions. And so there's a lot of tension there. I think it's a bit of a conundrum where advocates for the rule of law, those supporting democracy and civil liberties, have to turn to a judiciary that is certainly no consistent friend of democracy and civil liberties, and ultimately, a Supreme Court that did so very much to put us in this moment. So that said, I think we're seeing a little bit of a split screen between the lower courts and the Supreme Court. So a lot of district court judges have shown extraordinary bravery and great intellectual integrity in responding to lawsuits like those brought by Skye and her organization and others, demanding that the Trump administration adhere to the rule of law. Judges like Amir Ali, under fire from the White House, judges like James Boasberg, who've been threatened with impeachment by the president himself. they have stood up for the rule of law, and a lot of those decisions do affect public health. Judge Ali ordered the administration to pay nearly $2 billion in foreign aid funding that it owed to organizations, some of which involved public health. Other judges have tried to prop up USAID back on its feet, or at least get some of the funding for USAID programs to be dispersed. And others, like Judge Alsop in California, have tried to restore staffing to these federal agencies that have been absolutely gutted. Now HHS is facing these massive and likely illegal cuts, but it's happening throughout the administration. All of these career civil servants who help protect public health, who help protect our air and water and drugs and everything that affects our lives and livelihoods. The people who are enforcing those laws have been illegally purged. And so we have a lot of judges on the front lines who are trying to bring them back, trying to restore these programs that have been illegally cut, trying to restore some of the funding that has been slashed or impounded unlawfully. And yet, of course, all of these cases will eventually, or most of these cases will eventually reach the United States Supreme Court. And again, the Supreme Court has a checkered record. So it did allow the foreign aid decision, the $2 billion in funding, to stand, but only by a 5-4 vote. Which was, I think, quite disconcerting. And then by the end of last week, the Supreme Court issued another 5-4 vote that had essentially set aside $65 million that a district court had ordered the education department to pay out to public schools and universities. A different majority said, no, the government doesn't have to pay out that money. They went to the wrong court.
Docket too, Mark, right?
Of course, these are shadow docket decisions.
Right. Exactly.
With very little reasoning and obscure legal principles being deployed here. So, I think that it's an unfortunate situation where many of us wake up every day and think, how are John Roberts and Amy Coney Barrett feeling about the Trump administration? And unfortunately, given these kind of bizarre flips and unexplained decisions and shadow docket orders, it seems that, billions of dollars in funding and programs and staffing for all of these crucial public health programs at home and abroad, they may well rely on the kind of whims and snap decisions of a handful of justices on SCOTUS.
So let me just ask the three of you before we turn to questions of media and misinformation. Let me just ask what you see as perhaps the biggest health crisis, and I know that may be hard to say, and maybe Larry, I'll start with you, but really quickly, what do you see as the most serious crisis resulting in terms of health and global health from the first 100 days of this administration? And you're on mute. You're on mute, Larry.
Michelle, it's a great question. It's really hard to list one. I listed four in my opening, but if I had to choose one, I think it would be the withdrawal from the World Health Organization. This is really just heartbreaking and staggering. The United States was, helped form WHO. In fact, it was really the lead country in pushing for it at the end of World War II as the first specialized agency. WHO is so important to world health, but also so important to American national interests, with 70 collaborating laboratories that are monitoring novel viruses, GORON, the response network. So I think, I'm going to say that from a global perspective, it would be WHO withdrawal, but also from a national perspective, because I think the United States is going to be on the outside looking in. And I was kind of musing with myself very early this morning because I just returned from China, so I'm on a different time zone. I was just saying, how does anybody believe that the United States acting alone can secure its security alone, rather than in combination with 170 nations around the world that are monitoring and responding to novel viruses every day? I don't see any logic or rationale to it, but it is deeply wounding. I'm currently trying behind the scenes both to litigate this, and I'm doing that with Michelle, but also trying back channel negotiations between leadership at WHO and the Trump administration. And I have to say, it's jaw-dropping hearing from the Trump administration, because they're hiding the ball. They don't tell us what they really want, and they're pretty much intent on just throwing a bomb at WHO and global health. Um, and it's not a good time to be proud to be an American. I have to say it breaks my heart to say it. But from an international perspective, this is just truly devastating.
Thank you so much for that, Larry. And in fact, thinking about our Canadian family and our colleagues across the border, I want to start the next question with Tim Caulfield. And Tim, your work, you've done some of the most compelling work on misinformation, media, and threat to evidence-based policy with regard to health and its intersection with politics. So how is disinformation shaping public understanding and policy, and what can law, media, and science do about that?
Well, first of all, Michelle, thank you very much for involving me in this fantastic panel. It's an honor to be here. I'm going to go big picture, Michelle. I'm going to go big picture.
Go big,
and,
go big, Tim. It's like
it's the normalization, legitimization of things that are demonstrably false, and this is having an impact in the United States, certainly, but really around the world. The rise of misinformation, especially in health, I think is a generational issue. And look, there's so many things I could talk about. I want to list three. And the first one is the rise of policies that are based on things that are demonstrably false, right? And based on things that we can categorize as conspiracy theories. And just look at the jurisdictions in the United States. And by the way, this is happening around the world, including in my own country of Canada, jurisdictions that are seeking to ban mRNA vaccines. I mean, this is just insanity, right? Or jurisdictions, both again around the world that are seeking to ban chemtrails. Michelle, it wasn't that long ago.
Tim, just so that our audience knows, you're talking about vaccines that first were fought for to protect and save lives, and are the basic kinds of vaccines that would otherwise be given shortly after birth and through childhood. Those kinds of vaccines are now being thought of as being on the chopping block.
That's right. And look, this audience knows this. I don't need to say it again, but I'm going to anyway. Vaccines, and I'm sure this audience, this panel would agree with me, arguably the greatest achievement of biomedicine, right? And here we are, turning our backs on it. It's like Dark Age 2.0. And we are, and you can laugh at the jurisdictions that are seeking to ban chemtrails, which used to be a punchline, right? It used to be a punchline, but it really highlights the degree to which demonstrably false things have been normalized, right? And I'm not even talking about the attack. There's so many other examples you could use, right? The attack on gender affirming care, the attack on reproductive rights, on and on, all built on demonstrably false things. So that's number one. Number two, real quickly, and this is again a generational fear here, is the destruction of our knowledge base, right? And the erosion of our knowledge base. And we're seeing this in the attack on NIH grants. And let's just use one example, and there's dozens that we could use. The idea that people can't do research on vaccine hesitancy, and these grants are being canceled. What's this going to do to our knowledge base? And of course, the other really dramatic example is this proposed study to examine the connection between vaccines and autism. Another really stark example of demonstrably false being legitimized. And I think the last thing I want to highlight, and I don't think this is done enough, is the degree to which the efforts to fight misinformation, the efforts to do research on and understand this complex phenomenon are being cast as an infringement of freedom of expression. People who do this work are cast as the baddies, as the evil forces in this world, in a liberal democracy, which is, absolutely untrue. It's untrue on many levels. First of all, we know that those who, have spread misinformation, those narratives have been dominant. The narratives about the harms of vaccines, these weren't marginalized. They were, people were on the world's most popular podcast talking about it. They've been talking about it on popular cable news shows. They've been talking about it in the Oval Office. They haven't really been silenced. In addition to that, again, as everyone knows, efforts to fight misinformation, most of those efforts happen within the marketplace of ideas, right? It's about critical thinking and media literacy and debunking and pre-bunking and nudges. These things happen within the marketplace of ideas. But unfortunately, this rhetoric has been extremely, extremely effective. And again, very recently, there was a call for researchers in the United States to highlight if they're doing misinformation research or doing any research on, disinformation. And of course, that's a prelude to, I think, silencing that work too. So I'll stop there, Michelle. Scary times.
On that note, just to reiterate what you're saying is that there has actually been a call, a kind of chilling call, to find out if there are professors, such as yourself, who are doing research on misinformation, not as a bonus because one would want to address this and eradicate misinformation, but actually more in a chilling vein. I want to turn to Mark on that note and then to you, Regina, because this raises questions about the First Amendment and how journalists are coming to view this moment. What's your sense of how that's playing out in terms of First Amendment tensions, Mark?
Well, I think there's a great irony here because Donald Trump promised to restore freedom of expression in his inaugural address, and he has created these task forces that are allegedly designed to root out and uncover suppression of free speech under the Biden administration, which really just target modest efforts by the White House to work with social media companies to limit the spread of misinformation about vaccines. But now, of course, the Trump administration is turning around and launching these very serious attacks on journalism and journalists and media institutions in a way that seems designed to suppress and chill critical coverage of the administration. I mean, the White House is revoking press passes and revoking access to officials based on their questions that are perceived as hostile or overly antagonistic based on their own freedom of speech in their own reporting. So for instance, the AP calling the Gulf of Mexico and not the Gulf of America has led to diminished access to the White House and public officials, which would seem to be a cardinal First Amendment sin. And then, more broadly, I would say the White House is showing that it's perfectly comfortable going after protected expression in a way that's going to hurt the media and is going to hurt everyone. So for instance, going after law firms that represent unpopular clients or have hired individuals who are considered to be enemies of Donald Trump. The slew of executive orders targeting firms like Jenner and Block, Paul Weiss, Perkins Coie, because of their freedom of speech and free association. A lot of journalists are noticing and paying attention to this, not just because it represents a major threat to free speech and free association, but because we journalists frequently rely on pro bono representation by law firms when we ourselves are targeted because of our reporting and because of our own speech. And one of the many disturbing signals that I fear the White House is sending here is that law firms need to stop representing journalists who speak the truth or report critically on the Trump administration unless they want to face these kind of outrageous sanctions and penalties and retaliation by the Trump administration because of their own protected activities. So it's certainly a dark time for journalists. I would say even worse than many of us expected, in part because, and Tim was talking about some of this, the Trump administration has spoken about the values of free speech while turning around and relentlessly suppressing and retaliating against free speech in a way that seems designed to really censor the marketplace of ideas, to crack down on free debate and expression within journalism, within the scientific community, within academia. I didn't even mention this attack on students who've had their green cards revoked because of their speech. I'm sure we'll get to that.
Yeah.
All of it is making all of us less free to say what we believe.
Well, let's turn to, thank you so much, Mark and Tim. Regina, you're at The Nation, you're a senior editor there. I'm wondering how you view this moment and what it means for reporting and for people writing about these kinds of issues, because based on what Mark has said and what we're hearing is that there's a chilling effect.
Absolutely. We're definitely living in a time where the president of this country seeks to intimidate or threaten different media groups that choose not to amplify his rhetoric and disinformation without challenging it. So we're seeing that play out in a very real way. And it's really strange to be working in journalism right now, but I can't speak for folks at mainstream outlets, but that certainly isn't stopping us in the progressive space from continuing to speak truth to power, because there is still a truth, even if Trump and his followers don't feel that is the case. But I did want to share just like a very brief story, because I think it speaks to the media's responsibility in elevating all of these stories, telling the truth in this moment and what that can look like. So I recently had the opportunity to interview Shanette Williams. She's the mother of Amber Nicole Thurman, and actually my article at The Nation went live this morning if you want to check it out. But if you're not familiar with Amber Nicole Thurman's story, she was a 28-year-old mother who died in 2022 following a medication abortion. And the only reason her family found out that her death was actually completely preventable was because of a reporter at ProPublica who wrote this bombshell piece about her case. But, what her family learned in this is that the doctors had waited 20 hours before providing her a procedure that would take 15 to 20 minutes. But because of the abortion ban in her state, it was really unclear whether or not they could provide her an abortion. And so Amber's story, came out at this pivotal moment for the presidential election, and it was amplified by the Harris campaign. Shanette Williams appeared with Kamala Harris at an Oprah event. And ProPublica's reporting received a lot of attention for this story. And what happened after that piece went out is that the state of Georgia disbanded the Maternal Mortality Review Committee that had, someone on that committee had shared with ProPublica the fact that Amber Nicole Thurman's death was preventable, and it was reported on, and massive action by people in the state as a result of that. And so the state's response was to disband the committee, to release all the people on the committee, and to have those people be completely replaced by people who are going to be effectively gagged, right? Who wouldn't share with the media these stories. And so when I talked to Shanette Williams about this and what it was like, what it's going to be like for people whose children or loved ones, or they themselves or whoever might be affected by these bans, and what it means when the committees are disbanded, she said, we're never going to know unless doctors speak up, unless other people who might know what's going on speak up, because the states who have, the lawmakers who've put these laws into place are doing everything possible to keep what's actually happening hidden. And so that's why, like I said, I think this speaks to our responsibility as reporters, as editors in this moment, that we have to keep telling these stories, making these connections for readers. And because the anti-abortion movement, the folks who are, against people being able to make decisions about their own bodies, the people who are against our ability to live freely, and whatever that looks like for people, including trans people, they want to hide the reality of the impact of their laws. And so we have to, in all capacities, have to continue these stories, because we can't let them hide what's happening to people in communities in very real ways.
Well, to stitch that through line together, you mentioned this tragic death in the wake of anti-abortion laws that have been passed in Georgia and other states, and what that chilling effect has meant in that doctors with seeing patients who are in crisis, where they otherwise would have immediately intervened, are no longer doing so, such that there are patients being flown in helicopters out of Idaho. There are patients sitting in their cars for hours bleeding in front of hospitals. There are patients who've had to go back and forth. And it's worth just level setting and thinking about information, misinformation, that about 20 to 30% of pregnancies will end in miscarriage or stillbirth, just as a natural order of things, regardless of who is in the White House. But it has meant that medical care that would have been instant if a person has presented and now does not mean so. It can actually mean death. And this stitches together with what Skye was mentioning earlier in terms of the Emergency Medical Treatment and Labor Act, a law that was enacted and signed into law under the Reagan administration, and then under a Bush administration was affirmed to apply to matters involving pregnancy termination, that yes, it applied. I want to remind those who are with us today who our panelists are, and then we'll turn to reproductive healthcare and what that means in this space. I'm joined by Mark Joseph Stern, who's a senior writer with Slate Magazine, Skye Perryman, who's the president and CEO of Democracy Forward, Regina Mahone, whom you've just heard from, who's a senior editor at The Nation, Professor Larry Gostin, who's the founding O'Neill Chair in Global Health Law and co-faculty director of the O'Neill Institute, Moira Donegan, who's the opinion columnist at The Guardian and a writer in residence at the Clayman Institute for Gender Research at Stanford University, and also Professor Timothy Caulfield, who's the research director of the Health Law Institute and professor in the Faculty of Law and the School of Public Health at the University of Alberta. So one aspect that is certainly been in the news since 2022, although many have been talking about it beforehand, was the fall of Roe v. Wade and Planned Parenthood v. Casey in the Supreme Court's Dobbs decision. It was a decision that overturned nearly 50 years of precedent. In the years leading up to it, Donald Trump had said that he had wanted to criminally punish women who sought abortions. And then there was a pushback from that, or a rollback from that. But at the same time, he has spoken about how this was part of an agenda that included the elevation of members to the Supreme Court who would share his viewpoint to overturn Roe v. Wade. Those justices being Amy Coney Barrett, Brett Kavanaugh, and then also, Mark, help me, I just slipped.
Gorsuch.
Yes, with Justice Gorsuch. Yes, that was probably an intentional blank. And so with the three justices that are now on the Supreme Court, and we have seen the fall of Roe, and there are questions that still present before the court in terms of EMTALA, the Emergency Medical Treatment and Labor Act, questions with regard to the availability of mifepristone in the marketplace and challenges there. Moira, I want to start with you because there are questions about the frontal assault on reproductive freedoms and gender protections. What do those look like in these times?
Yeah, I think you're absolutely right, Michelle, and thank you so much for having me. And I think that what we have seen over the first 100 days of the Trump administration is an intensification of federal support for state-level efforts to restrict reproductive health care and abortion access. Regina mentioned these tragic cases in which abortion bans are causing treatable medical conditions during pregnancy to go untreated, often with fatal and tragic effects. What we also see is an increasing degree of sort of legal hostility to the sort of workarounds that abortion seekers and pro-choice advocates have established in the years after Dobbs. So in Texas, Attorney General Ken Paxton has issued both a lawsuit and I believe also a criminal prosecution against a New York State-based abortion provider named Dr. Maggie Carpenter, who is one of many providers located in states, usually Democratic-controlled states, that have what are called shield laws that prevent them from facing prosecution from Republican-controlled states for their administration of abortion pills via telehealth and through the mail, right? So Ken Paxton is now both suing Dr. Carpenter and attempting to prosecute her in the state of Texas, and the state of New York has just thrown his attempts to bring her to justice in Texas out, which sets up a conflict between Texas and New York over these shield laws. I would expect to see the Trump administration in the future support states that seek to challenge these shield laws and extend the sort of legal force of abortion bans outside of red states and into these blue states, right? So I think we're going to set up for a states' rights conflict over the coming years. I also think we have now a sort of federal health bureaucracy that is newly emboldened to oppose mifepristone access. So this abortion by mail regime that has really saved a lot of lives and enabled a lot of personal freedom in the years since Dobbs for abortion seekers in red states relies on a couple things. It relies on the general acceptance that the 1874 Comstock Act is no longer in effect. That is an interpretation of that law that some members of the Trump administration and many folks on the organized legal right have indicated that they wish to challenge. And we also have a sort of reliance on a 2021, I believe, era mifepristone regime that allows it to be administered by mail and up to, I believe, 12 weeks of gestation, which is something that the Trump administration may also challenge as well, which would make it much, much more difficult to get those pills into the hands of people who need them. We also have, and I think this like touches on something that Tim and Regina were also, talking about, we have sort of a rise in the power of fiction, and that's both like scientific fictions, but also I would say moral fictions, right? So one moral fiction that I am, personally offended by the efficacy of and the enforcement of is the notion of the equality between the dignity and worth of a fetus or an embryo and an adult woman or a human being who is esteemed to not have equal worthiness or equal deserving of care under a lot of these laws, right? I also think we need to look at the enforcement of legal fictions. When we look at, and of moral fictions, when we look at the Trump administration's treatment of transgender Americans, which has also been a very prominent part of their gender hostility regime. So we have Trump administration's ban on transgender service members in the military. We have their executive order saying that there are only two genders, which has caused tremendous bureaucratic hassles for a lot of transgender Americans trying to get their correct documentation in place. They are being issued documents and passports that have incorrect information that are elevating a lie. I think this is also part of an epistemic attack. And we have a ban on youth transition via this executive order, which has scared a lot of providers out of providing this life-saving care to a very, very vulnerable demographic, right? So we've got a large amount of fronts that are creating a holistic attack on the status of women and gender minorities.
Well, I'd like to then turn back to you, Regina, because of what this then means for communities that across intersectional communities based on class, based on race, the reproductive justice as being highlighted in the media. What does that look like?
Absolutely. So one of the things that we talk about in my book, Liberating Abortion, which I co-wrote with Renee Bercy Sherman, is the fact that having bodily autonomy must include the right to parent, because you can choose to have children and that's all well and good, but now families that have children are worried about what might happen with access to education, healthcare, food, housing, all of these things that are under attack under this administration. And so the reproductive justice framework centers all of those needs. It's defined as the right to maintain personal bodily autonomy, the right to have children, the right to not have children, and the right to parent those children in a safe and sustainable community. And it's so important for the media to cover, as I talked about with Jeanette Williams' case, like it's so important to cover not just the abortion bans, but also what's happening with these restrictions that then puts people in this criminal justice system, right? For how they're choosing, the decisions they make about how they're able to parent their children in this climate. Professor Dorothy Roberts calls this framework the family policing system, and we're seeing it bear its ugly head in so many ways. There's a case that I always think of that came out of Dallas 2 years ago, where there was a newborn that was taken from her parents because the pediatrician didn't like how the parents were choosing to treat her jaundice condition. Basically, they had a midwife, and so they're just like, we can give her the treatment she needs in our house. We don't want to go to the hospital because of the way that people are being treated in hospitals, especially if you're a person of color, especially if you're a migrant. All of these intersections come into play when people are seeking healthcare. And their pediatrician did not like that, and CPS was called. Their child was taken, a newborn child was taken from them for nearly a month. And this is reproductive injustice. And so just like these cases of family policing, we have to, as journalists, we have to cover all these other ways that the right to parent is being stripped from people. You know, Jeanette Williams lost her daughter, but her daughter, who is no longer with us, had a child, and that child lost their mother. And so we're seeing people, you know, experience it in that way. We're also seeing people who are being criminalized for their miscarriages and arrested. They're being taken from their children. The majority of people in this country who have abortions are parents or have a child or children already. There's also, I mean, I could talk about this all day, but there's also the issue, the timely issue of the maternal health care crisis. And that's being exacerbated by these abortion bans. Actually, next week is Black Maternal Health Week. And a few years ago, I had interviewed one of the founders of the Black Mamas Matter Alliance, and she told me, you know, this isn't just a maternal health crisis, it's a maternal health care crisis. And these are all policy decisions, lawmakers deciding what care is available. And now we're seeing with Trump back in the White House, they're making decisions not only about what care is available, but what conditions are being researched, as we've been talking about, what programs are being funded through their funding cuts. All of these things are reproductive justice issues. And I think that's why it's so important to take this broader reproductive justice lens when reporting on these issues, because they affect people whether or not they're having abortions. They affect people, they affect women, they affect parents, they affect all of us when it's our loved ones and community members on the line.
Before we begin our process of wrapping up and final questions and comment, I want to turn to Skye, because what you both have mentioned, you and Moira, have been these the executive orders, the confrontation of issues with regard to contraception and abortion. Regina, you've mentioned what it means in terms of parenting and education. And Skye, I want to turn to you, because what we've seen is what some are calling a full frontal assault that affects all of those conditions, from education and the dismantling of the Department of Education to what have been called into question DEI and what it means that in terms of the words that can be expressed in government. Can you fill in a bit on that?
Sure. I mean, I do think that what we're seeing really is a full frontal attack. And I think the best way to look at it is a full frontal attack on freedom. And you see it at both the federal level and at the state level. I just want to make sure, and I know it's been alluded to, but there are a range of states that are operating, you know, very similarly to the way the federal administration is. They may have different tools in doing so, but this really is. And it really, regardless, and we all have very strong commitments to healthcare and reproductive health and reproductive justice. What we are seeing now is truly that relationship that we've always known existed between those concepts and our overall freedom of a society, and sort of an increasing risk of autocracy. So what that takes the form of is, as you've said, federal action and state action, and frankly, action by far-right organizations that are, extra governmental, that are not governmental organizations, that are seeking to intimidate and seeking to take a position that people cannot use certain words, diversity, equity, inclusion, accessibility, really seeking to impose fear into institutions to chill and stymie work, even in instances where the actions that state and federal governments are taking are unlawful, but yet nevertheless that fear, starts pre-chilling the pre-chilling the work and the care. And then of course you see a range of concerns around healthcare and reproductive healthcare access, contraception, abortion, gender affirming care, and really I think would challenge us to look at that not just as a healthcare issue, although that is huge, right? We're on the O'Neill Institute webinar, but also as a way of really seeking to chill and to stop and to criminalize in many instances what is also the natural result of evidence, data, science, evidence-based care, professional ethics, and all of the things that healthcare and public health and medical providers do on a daily basis to care for people. And then you have the obstruction of federal protective mechanisms. We saw that with the Dobbs Court, of course, trying to take away, and in fact taking away, a recognized constitutional protection around privacy. But what's happening now in states and at the federal government is going far beyond that, right? It's seeking to undermine laws that Congress has passed, like EMTALA, which we've discussed, approvals that the FDA has issued, such as with respect to mifepristone and its regulation, and seeking to really create a mosaic of entities and states where even federal protections may not be available there. So this is really a perfect storm, not just for healthcare, but for our freedom overall. I can assure you that all of us on this call are going to be doing everything we can to combat it, but it's something that requires, I think, a really heightened level of vigilance at every single turn.
Okay, so we have just a few minutes left, and so I'm going to ask if you take these questions with less than a minute, even a matter of seconds, just to go to some rapid fire. So I'm going to start with you, Mark. If the courts are unavailable, and these are coming from our listeners, if the courts are unreliable, then these issues become political and have to be dealt with in an openly political fashion. What's your response to that, Mark?
I think these issues are in many ways fundamentally political, and there should always be pressure on Congress to actually step in and do its job. So much of what the administration is doing is contrary to Congress's will, refusing to carry out appropriations that Congress has made, refusing to honor agencies that Congress has created. There should be immense pressure on the Democratic branches. Even the presidency. There should, of course, be protest, as we saw this past week, saying this is not what the people voted for and what democracy is. I will just note briefly that I think courts feel they have more latitude to do the right thing when they feel that popular will and sentiment is on their side. And so the more that people pressure the Congress to step in and do the right thing and protest against the administration, the more you see sort of the popular will turn against the president and Musk and many of these actions. I think the more latitude courts will feel that they have to issue some of these decisions, and especially decisions that might be sort of testing the limits of the law, like ordering the administration to return migrants who were unlawfully sent to El Salvador.
Rapid fire. Thank you so much for that, Mark. You're absolutely spot on. Larry, rapid fire. The fold up of USAID is devastating for African countries. What happens to the assets and knowledge hubs USAID has accumulated in Ghana and other African countries?
I think the knowledge hubs virtually disappear. One day we might have a president and a Congress that will, understand really how important the world is and how important it is for us to fight poverty, hunger, intervene in humanitarian crises and in global health, all of the things that really are the American way, and there have been for so many years. But you can't save lives that are lost. You can't replace treatment when HIV treatment is gone. You can't, care for an infant when their mom has died. And you can't replace skilled staff and knowledge hubs in Africa and other vulnerable parts of the world once you dismantle them. This is a serious crisis, and we need to view it that way. And all I can say is that, we all need to speak as one, as Americans, which is that we need to care for each other and we need to care for the world and have them care for us.
Thank you so much for that, Larry. Tim, rapid fire. So with the misinformation that is flourishing around the world, in the United States, we see it at a particularly pitched degree. What, if anything, can be done, especially as it relates to vaccination?
Well, first of all, and I think this is a theme we've heard during this entire session, we cannot let the chill win. We can't let the chill win, and we've got to speak up. So I actually think that we need to hear more from scientific organizations. I think we need to hear more from professional organizations. I think we need to hear more from universities. We have to speak. We cannot let the chill win. And by hear more, I mean speaking both about what the evidence and science actually says on a topic, but also on the importance of pushing back against demonstrably false narratives, be they moral narratives or be they scientific narratives. And so I really think that is very important. And the other thing to recognize is that the tools that are being researched to fight misinformation, they work. They work. They're not perfect, and we have to come at this from absolutely every direction, and we're still learning more about how to do it. But yes, critical thinking, media literacy, pre-bunks, debunks, nudges, these things really can make a difference. And everyone involved in this seminar can play a little role in making sure that all those things happened, even when we have an administration, a regime that's trying to silence those tools.
Moira, what's next in light of LGBTQ communities and the attacks that have been seen? We've seen the Trump administration withdraw from litigation in Scrimeti, where the Biden administration was involved in that case. That's the case that involves gender-affirming care in Tennessee. What comes next? Are there signs of hope?
I think there's a real underrated determination and sense of mutual responsibility in a lot of these communities that always gives me hope, right? The way that people have rallied to protect transgender youth in particular, the way that LGBT communities have pooled resources to help members of their community get those correct documents, get the legal help they need. These are wells of generosity that are not just more powerful than we give them credit for, but they're often more persuasive, right? I want to talk about, back to Tim's comment about the methods of persuasion, of de-radicalization, of information, environment, hygiene. One of the things we do is the moral hygiene of taking care of those who are targeted among us, which can draw attention to the injustice of their persecution. A lot of people do not like bullies, and much of what this administration is doing is bullying. It's targeting the vulnerable and the innocent for no reason other than contempt for their difference. And I think that will repulse people. I have greater faith in the capacity for moral outrage and collective action. And that's what gives me hope.
Regina, what's the message that you'd send to your fellow journalists about courage in these times?
I'm following in the footsteps of folks like Jeanette Williams. I shared her story, and I'll keep sharing her story because I can't tell you enough of the level of heartbreak you witness and seeing someone share a story like that, but then knowing that she has a grandson who lost a mother, but she is standing in the way and leading the way forward and telling the story of his mother and what happened in her life, and showing that her daughter did not die in vain. Her grandson's mother did not die in vain. I think it's really important for us. It's a challenging moment to be a journalist because we're being attacked, but it's even more challenging for the people who are actually losing loved ones, losing their jobs, and on the front lines of this crisis in a very different way. And so I do think we can take a lot of leadership and hope and strength from those folks, because at the end of the day, like, we're in this together as one community, and we have to continue showing up in that way, by creating the space to tell these stories that may be a little bit more complicated than than we're comfortable with or used to, but really just like telling the truth, because that's what we have in this moment, and it is a source of power and strength.
And Skye, before we wrap up, a question for you that I had from the very start but didn't ask. How unusual is it that we've seen this degree of executive orders in the first 100 days of a presidency?
Yes, this is not normal. This is not normal. We're starting to see the numbers of executive orders in these first 100 days that you would normally see almost in an entire presidency. And there's a really important reflection around, we don't purport to know entirely what motivates this administration, but what we do know is that they don't have public support for the things that they are doing. In the in the campaign, when Project 2025 became exposed to the American people, polling consistently showed that among progressive people, among conservative people, among independent people, that this extreme and extreme sort of policies were not at all supported, which is why, of course, now members of the administration were running away from them on the campaign trail. And so now they're seeking to accelerate those, and they don't have popular support for them. So they are seeking to do through executive order what they cannot do through the legislative process. And then they are gaslighting our court system and our rule of law system. Again, to Mark's point, not necessarily a system that has always delivered for people and democracy, but even in the system we have, you have that system working overtime to put the brakes on much of this because it's so outside the bounds. And now you have an administration that is seeking to go after that. So I just will say it's not normal. It's part of a plan in many instances to deprive people of their ability to determine for themselves, our collective society, to determine our path forward. But there are ways of pushing back, and it's through this collective action, things like what we're doing today, and then of course the legal and other processes.
I want to thank all of our panelists and thank you, audience, for joining us today. We could really spend so much more time doing this. I look forward to our future conversations as we continue to track this. I thank you all for the advocacy, the brilliant work that you've been doing, and I hope you'll join us again at the O'Neill Institute as we continue to cover these very important issues. Thank you all so much.